My name's Marlene Garcia. I'm one of the new faculty here at UTESCA, one of the new faculty in Interventional Cardiology. I did my medical school and residency training at UT Southwestern in Dallas. And when I interviewed here for cardiology, I sort of had this very sort of warm feeling to the program. It was smaller, it seemed more intimate, and I kind of wanted a change of pace compared to the larger program that I was at. So I decided to come to San Antonio. That, in addition to, I think, a higher number of Hispanic patients, drew me to the program. And so I came here and I did my fellowship training. And one of the things I noticed during fellowship was the availability of mentorship. You know, a lot of my faculty were very easy to approach, easy to talk to. Dr. Prasad, who does a lot of research, was quick to invite me in on some of his projects and mentor me through some of those. And there was a position where I could do a year of research after my fellowship, followed by my interventional year, which I was quickly drawn to because I've always wanted to stay in academic medicine. And I sort of wanted that break, that time to figure out how to publish, how to conduct research, just to how to focus on my career development. And under an NIH T32 grant, I was allowed that opportunity. And I'm just really happy that I took it because I think it really made a difference. As a woman in cardiology, you know, I had my daughter during fellowship, and then I ended up getting pregnant with my son. And I asked, you know, our chief at the time if I could extend my fellowship, research fellowship, for another year, and his response was absolutely. Did not blink an eye. He said, as long as you're ready to do interventional after that, I'm okay with it. So I extended my research training for 2 years to allow me to sort of balance motherhood and research in preparation for a career. And I'm just so grateful to the program to allow me to do that. So then after those 2 years of fellowship, I did my year of interventional training, which was very, very tough. But, you know, the faculty mentors that I had throughout the training were really looking out for my best interests, making sure that I was doing okay. I had faculty who would look at me and could tell, you haven't seen your kids in 2 days, go home and see them. You know, there are plenty of procedures tomorrow. And so I sort of like that sort of looking out for each other mentality that I have with my faculty. And even now that I just started as a faculty, that transition from fellow to faculty, you know, I had a really tough case yesterday on my first day, and I had faculty there, you know, Dr. Almamani and Dr. Prasad and Dr. Chilton, saying, we're here if you need us. We know you can do it, but we're here for you. There are a lot of reasons why women don't go into interventional cardiology. You know, people have personal reasons, but there are some common themes, and one of those is it's known to be a difficult field, you know, high stress, lots of call, middle of the night, wakenings, long days. There's that. And then the second thing is a lot of us are of reproductive age when we're in our cardiology training. In the cath lab, you're exposed to radiation, and so you're also wearing lead. It's heavy, so there's mechanical, there's radiation exposures that women may not necessarily want to endure during a pregnancy. And the fact is just balancing it all, being a mother, being a cardiologist, being a researcher, being, you know, trying to do it all, this just can be very challenging. Another reason that I think people shy away from it is there are no females in the field, or very few females in the field. So it's hard to seek a position where you don't see someone like you in that position. And that was definitely very challenging for me when I made the decision to pursue interventional cardiology. At the time that I decided, I was pregnant with my daughter. And I just remember one moment I thought, you know, I don't want my daughter not to do what she likes to do just because, you know, she's afraid, or are there no opportunities for her to do that? So I felt like I sort of had to set the example and pave the way for her and for other women. And to be honest, I had great, you know, mentorship and people who said, you can do it. You know, you can pave your own way. You can figure things out as you go. You can make your career unique. You can make it work for you and your family. And that's what it's been so far. I think that mentality of them wanting you to succeed, you know, and having that mentorship, that collegiality, that's really what's led me to stay here.